So what is gentamicin? It's an aminoglycoside. It's an antibiotic that is used to treat a variety of gram-negative infections. Gentamicin should be reserved for serious bacterial infections. However, alternative uses have been found. The mechanism of action is that it passes through the gram-negative membrane of an oxygen-dependent active transport system. Aminoglycosides are ineffective in anaerobic bacteria because oxygen is required. Once in the cytoplasm, the medication binds to 16S rRNA and this 30S ribosomal subunit, halting mRNA translation and resulting in non-functional protein. Gentamicin also works better in higher concentrations, so the more of the antibiotic you have in your system, the better it's going to work. Gentamicin is also effective against gram-positive bacteria, so that makes the mechanism of action unknown. What are the reasons for taking it? Systemic infections, so serious bacterial infections in the urinary tract, GI tract, and CNS, such as meningitis. Ocular infections, bacterial infections such as conjunctivitis and keratitis. Superficial infections such as skin and subcutaneous infections. Injections such as burns, superficial folliculitis, and abrasions or cuts. And integumentary infections, so dermatitis, pustular psoriasis, and pustular acne. Unofficial uses, cystic fibrosis, endocarditis, prophylaxis, febrile neutropenia, gonorrhea, and a lot more.
Expected adverse effects include nausea, vomiting, rash, and burning. Serious adverse effects include ototoxicity, nephron toxicity, neuromuscular blockage, and neurotoxicity. Neuromuscular blockage and respiratory paralysis have been reported when used too soon after anesthesia. Can possibly be reversed with calcium salts. Population considerations are the following: spinal cord injuries alter neurofunction, potential differences in renal elimination and distribution among body tissues. Pediatric. The portion of total body water to total mass is highest in neonates and declines with age. Due to the fact that gentamicin is water-soluble, these patients may have variable PK profiles and drug distribution. Immature renal growth and function is also a problem with these patients. Geriatric. Reduced renal function, which causes increased accumulation.
Dosing of gentamicin for IM injections or IV infusions depends on the weight and the age of the individual receiving the medication. Topical dosing is simple. For adults and children, you apply the ointment to the affected area 3 to 4 times a day. For ophthalmic dosing, it depends on the severity of the eye infection. So for adults ranging to children, you give 1 to 2 drops every 4 hours for 2 days. If the infection is severe, you give 2 drops every hour. Contraindications. Gentamicin is inactivated by penicillins and cephalosporins when co-administered to patients with renal insufficiency. There's a possibility of respiratory paralysis after inhalation of anesthetics or neuromuscular blockers. There's increased incidence of ototoxicity with loop diuretics, as well as increased incidence of nephrotoxicity with other nephrotoxic drugs. Other contraindications include hypersensitivity to gentamicin or other aminoglycosides. You must take certain precautions in regards to pregnancy, breastfeeding, corneal healing, or local redness or irritation, and you must use caution in infants as the renal system is underdeveloped. Gentamicin drug interactions. Gentamicin has no known severe interactions with other drugs. Other drugs that may impair renal function may decrease the elimination of gentamicin. Concomitant use of other antibiotics that express beta-lactam potentiate the action of gentamicin. You must avoid potent diuretics such as furosemide because they increase the risk of ototoxicity when administered IV. Diuretics may enhance aminoglycoside toxicity by altering antibiotic concentrations in serum and serum tissues.
Pharmacokinetics of gentamicin are heavily influenced by age and kidney function. Intramuscular injections and IV infusions are rapidly absorbed and peak in 30 to 90 minutes and 15 to 30 minutes respectively. Topical preparations do not effectively penetrate dermal barriers, so they have no clinical systemic implications. Gentamicin is water-soluble and widely distributed across extracellular fluid. Minimal distribution into cerebrospinal fluid occurs. Small amounts can enter placenta and breast milk. Clinically high concentrations are reached in renal cortices in the inner ear, which can lead to nephrotoxicity, ototoxicity, and precipitate vestibular disturbances. Little to no phase 1 hepatic metabolism occurs. Over 90% of the drug is excreted unchanged through the kidneys. Tissue accumulation of gentamicin independent of drug elimination has been evidenced. Body mass is not predictive of elimination. Half-life is variable among patient age, renal maturation, and renal functional efficiency. Serum trough levels greater than 1 mg per liter are correlated with nephro and ototoxicities. The therapeutic index is derived from the peak being tenfold of the minimum serum level required to inhibit bacterial proliferation, which is known as the minimum inhibition concentration. Intermittent drug-free periods between doses may help reduce effects of toxicity and bacterial resistance as long as the period does not permit bacterial regrowth.
Nursing considerations. It is important to obtain specimens for cultures, such as serum for a complete blood count, urinalysis for creatinine clearance, and estimated globular filtration rate. Note the sensitivity and weight prior to therapy initiation. The first dose may be given before receiving the results. Nurses need to assess for signs of an allergic reaction. This may appear within seconds or minutes after it is given. Monitor for rashes, weak or rapid pulse, trouble breathing, swelling, etc. Assess for infection. Vital signs, wound appearance, sputum, urine, stool, white blood count at the beginning and throughout therapy. Assess for vestibular dysfunction. Assess for signs of an overgrowth of infection and signs of a superinfection, which is a second infection superimposed on an earlier one. Symptoms for both may include fever, upper respiratory infection, pain, redness, vaginal itching or discharge, increasing malaise, change in cough or sputum, and diarrhea. It is important to monitor serum levels during therapy for toxicity overdose. These are drawn at 30 and 60 minutes after an IV infusion or 60 minutes after an IM injection. Monitor vital signs during infusion. Watch for hypertension and a change in pulse. Monitor intake, output, and daily weight to assess hydration status and renal function. It is important to keep patients well hydrated. 1,500 to 2,000 milliliters a day during therapy. Monitor the IV site. Check for thrombolytics, including pain, redness, swelling every 30 minutes. If needed, discontinue. Apply a warm compress to the site. Evaluate the patient by their therapeutic response. The goal is to decrease infection, which will improve symptoms.